So when you get diagnosed with prostate cancer, it's a very scary and sometimes intimidating process. And I think the first thing that I tell my patients is, it's okay. Prostate cancers generally are less aggressive than almost any other cancer you're going to encounter, and it's very curable cancer. Even if it's not curable, we have so many great treatments to prolong survival, and oftentimes people die with cancer instead of cancer. But second to that, the number 2 point is, it is a big spectrum. There are some cancers which are not that aggressive and you can just keep watching them. And there's some cancers that are aggressive and yes, it's curable, but you need to go and treat it right away. The third point is, prostate cancer is a multidisciplinary cancer, which means you have to get all the inputs from your radiation oncologist, from your surgeon, from your medical oncologist to all work together to find the best treatment. And so it's a very collaborative effort, and it's not enough to just see one doctor. You really need to see all the different specialists. And number 4 is, this is a very fast-changing field. The treatments that are available now are completely different than what was available even 5 years ago. And so there's a lot of information on the internet from friends, but you really need to talk to an expert to get what's the most latest up-to-date and what makes the most sense for each individual patient. I think it's really important to get your treatment at a large facility. And I think there's levels of quality that have been established. And in Kansas City, we're the only facility that's an NCI-designated cancer center. What that means is that we have a certain level of expertise and certain quality that's proven. It's well known that NCI-designated cancer centers provide better level of quality, better outcomes compared to other facilities. And so it's your cancer. Of course you want to get treated at the best place possible. Whenever a patient asks me whether I should get a second opinion, I always say absolutely. Now, not everybody can have the ability to travel to get a second opinion, but for those people who can, I think it's a very, very important part of the whole cancer decision-making process. Second opinions allow you to get more expertise that's not available where you are, but also gives you a sense of reassurance that you actually made the right choice. Look, you wouldn't buy a car without going to a couple dealerships. And and the same thing with cancer treatment. We need to make sure you've going through the best, you've looked at all the different options before making how you're going to get your cancer treated. We are the only cancer center in the Kansas City area to offer expertise. What I mean by that is we're the only cancer center where our physicians are site-specific experts. We're experts because we do research in my case, prostate cancer. We go to meetings, we present at meetings, we give lectures, we teach residents about how to treat these cancers, and we do clinical trials. So we are the most up-to-date on whatever cancer, each of the different cancers that we treat. Furthermore, at KU, what we have is the latest technology in addition to the expertise. We were the first cancer center in the region to use space OAR, which is a gel that we use to push the rectum away from the prostate to reduce side effects. We're the first cancer center to use 5 shortened treatment courses called SBRT, which dramatically increases the convenience of treatment, going from 9 weeks to 5 weeks. We also are the only cancer center now to offer brachytherapy, which is radioactive seed implants into the prostate, which makes treatments very convenient for some patients because it's one treatment, and potentially also increases the cure rate for higher risk patients. And finally, we offer clinical trials. We have a large array of clinical trials that are suitable for different patients throughout different stages of cancer. And that allows us to be at the cutting edge of treatments for prostate cancer. KU is the only academic cancer center in town. And what that means is that not only do we have the latest treatment options, but we have today the treatments that are going to be available for 10 years down the road for everybody else. And the way we do that is by offering clinical trials. Clinical trials are experimental treatments, but always done as safe as possible. And what that allows you to do is to be at the forefront of the cancer treatments. Clinical trials, though, are what allows us to go from yesterday's treatments to today's treatments, and from today to tomorrow's treatment. So it's incredibly important to be treated in a multidisciplinary fashion. So, I'm a prostate cancer expert, but I also work with other experts in prostate cancer, surgical urology, and medical oncology, who are experts in prostate cancer. And so when we put our brains together, this is where you get the best possible treatment for patients with prostate cancer. So we routinely discuss all of our difficult patients. We meet at tumor boards to discuss our cases. And I think what we have is an incredibly collaborative effort where we're not trying to further our own agendas, but we work together for the best of the patient.